Rare diseases pose a serious challenges in terms of both diagnosis and treatment in Kenya. The challenges posed by rare diseases have evolved in recent times in Kenya, but lacks clear diagnosis and management, awareness and patient empowerment. No clear registration or policy that seeks to set up incentive for drugs invented or repurposed for the treatment of rare diseases. Poor families have limited access to medical knowledge, resulting in delayed diagnosis, early treatment, and intervention. There are instances where children are misdiagnosed and loaded to unnecessary treatment and surgeries, with caregivers facing financial hardship. This has contributed to high mortality and morbidity amongst young children aged below 5 years with rare diseases. Children with rare diseases and their caregivers face retrogressive social-cultural and religious beliefs, and many have been exorcised, socially excluded, labeled as an unclean. Stigma and discrimination for them is high, and it is common to find children with rare diseases being socially, economically, and culturally vulnerable and isolated both at home and in school. Through a community-centered design approach, we have created a solution named ScreamIT Chatbot, an AI-powered conversational solution that is enabling help caregivers of children with rare diseases, community health volunteers, and healthcare providers easily connect with each other. The chatbot is playing a critical role in making relevant healthcare information on rare diseases accessible to caregivers and stakeholders on real time, thus increasing delivery of physical and virtual emotional support to children with rare diseases and their caregivers in Kenya. It links them to a community support where they can talk to each other for emotional support, express their frustration, grieve in an anonymous way, and say difficult things without being judged by anyone. Queries coming in on the ScreamIT chatbot help in creating more responses in real time. In future, caregivers and their children will document their journey, co-create localized intervention for adoption by individual families and communities at large. More community of care virtual groups, support groups, and advocacy groups will involve. Professional counselors, medical personnel, and CHVs will be able to link and offer trauma counseling, psychosocial support, answer queries, and referrals on real time. Caregivers will also be linked with health facility or organization within their community for support in real time. The chatbot, through a co-creation with the communities of care, will be accessible and available in many local dialects in Kenya to create more awareness and sensitization on rare disease.